Welcome to the fourth in a series of webinars the Workers' Health and Safety Center is hosting on health and safety during COVID-19. I'm Roger Silva, Construction Training Specialist with WHSC, the only designated health and safety training center successfully operating for more than 30 years. We've been working hard to answer your COVID-19 questions individually and through information posted on our website. Today, we're looking to expand our reach further still, all in an effort to help safeguard essential workers who continue to work outside their homes during these challenging and unprecedented times. So let's get started with a quick overview. Today, we'll be looking at hazards of working in construction during COVID-19, health and safety laws that apply to COVID-19 in construction, information, instruction, and training. We'll look at the elements of a COVID-19 action control plan, and we'll look at emergency procedures and reporting requirements. We know that the virus spreads from person to person. It happens when we touch our eyes or mouth, nose and mouth. Many can transmit the virus, although they don't show any symptoms. This is why being close to someone is a potential exposure to the virus. The routes of transmission are contact and inhalation. We make contact with contaminated stuff and then touch our eyes, nose, and mouth. Transmission through inhalation happens when we breathe airborne droplets from others. Tiny droplets are cast into the air when we speak, but especially with a sneeze or a cough. Every day, workers are expected to work side by side. Some places maintaining a safe distance is difficult, if not impossible. Areas where we're in close proximity to one another are scaffolds, elevators, or hoists, and sometimes in immediate working areas where we're working with another worker, holding something in place or lifting and carrying objects. We also gather at the coffee truck, washrooms, eating and changing facilities. We certainly gather at muster points or during Toolbox Talks. Shared vehicles is another concern, because a lot of times we use the vehicle to get from one area in the site to another. Evidence shows that coronavirus can live on surfaces for hours, even days. Generally, the harder the surface, the longer the virus lives. Surfaces include equipment like forklifts or other heavy equipment, on devices such as slings, shackles, or even radios or other communication devices. Let's look at our everyday tools, such as the hand tools that are in our pouch, or larger tools like shovels, picks, or sledgehammers. But that's not all contaminated surfaces from building materials that we use every day, like wood, rebar, pretty much anything that we work with to build what we're building. In many cases, we have to share PPE, like fall protection equipment. It's often hanging on a hook so anyone can use it. I could spend all day highlighting possible COVID-19 hazards, but let's talk about what the law says. Since there are no specific laws for COVID-19, we'll look at the General Duty Clause first. And the Occupational Health and Safety Act states that an employer and supervisor must take every precaution reasonable in the circumstances for the protection of the worker. And the word reasonable is certainly being put through the test during COVID-19. The regulation for construction projects states that there must be clean and sanitary washroom facilities and clean hand washing facilities. The Ministry of Labor and the Chief Prevention Officer released a guideline for construction work during COVID-19. Although it's not a legal document, it will help employers and workers understand what it means to be compliant, and the Ministry of Labor can then enforce it. If you have any concerns, speak with your supervisor, your Joint Health and Safety Committee, or your safety rep. But if you need to call the Ministry of Labor, the number is on the screen. Now let's consider controls. The most effective control is at the source. And at the source would mean that we would eliminate the hazard by not going to work. And for some, that's a possibility. But for essential workers in construction, that is not the case. So we have to go to the next best type of control, which is a control along the path. It's less effective because it doesn't eliminate the hazard. It's basically putting a barrier between the hazard and the worker. The least effective method of controlling a hazard is at the worker. And that typically means that we're going to be wearing some type of PPE. Now, PPE was designed for emergencies, temporary use, or to supplement the control like those along the path. However, with COVID-19, it is essential that workers practice personal hygiene. It's absolutely necessary. Again, since controls at the source for essential workers is not an option here, let's look at some of these along the path. The first thing is that we want to reduce the number of workers in a specific area or on the site. And we can do that by ceasing non-essential work. Then we will look at staggering shifts. Perhaps stagger the start times to allow more space between workers coming in, allowing more safe distancing of hoists or elevators. It would also allow for staggered lunches where then there would be less people at the lunch area. Especially important in smaller workplaces. This is essential to maintain safe distance. And the safe distance, as we all know by now, is at least 2 meters or 6 feet. In some cases, workers can work behind barriers. Construction, that may not be possible. However, if you're operating a device, a piece of equipment like a skid steer or an excavator, where it's in an enclosed cab, then you're protected by that enclosed cab. And other workers should not be approaching you in that area. The other thing we want to look at is the sharing of tools and equipment. We need to sign a set of tools for each worker, color code them, put some tape on it with their names. So basically that person will use those tools all day. One operator for each piece of equipment. I know this may not be ideal, but it's a necessary measure. And if possible, when we're handling materials, only one person would handle the material. So if you're grabbing 2x4s, grab them for yourself, and the other worker will grab their 2x4s. Again, minimizing contaminating or possible contaminating the materials. We all have to clean and disinfect our tools. Now, even if you're using them yourself, you would have to clean and disinfect at least twice a day. If they're going to be shared, they need to be cleaned after use, so that when someone grabs a tool, they're already cleaned. And if that's the case, then we need to have ways of identifying that that has happened so that workers can use the tool safely. Sanitize equipment at least twice a day, even if you're the only user. We need to wash our hands regularly as well, as you know. Now, avoiding contact with our face is something that sounds easy, but it's not as easy as it sounds. We instinctively touch our face throughout the day and we don't even realize it. For example, you're working away and wind blows and some sawdust goes into your face. The first thing that you do is instinctively try to wipe the sawdust from your eyes. Now, even if you have gloves, gloves are a surface and they can be contaminated. So it's very important that we remember and we're always avoiding touching our face whenever possible. And as I mentioned before, hand washing is one of the best ways to maintain safety here. We need to have more supply. Employers have to provide more time for people to wash their hands, maybe extend lunch and breaks so that it allows people to wash their hands. Obviously, we can't crowd a washroom or a hand washing facility, so we're going to need more time there. We also need these pieces of equipment throughout the work site available so that workers can wash their hands on a regular basis. In the case where we can't have running water, then the employer has to supply hand sanitizer, and the sanitizer should be abundant everywhere that people go. And the hand sanitizer has to have at least 60% alcohol. Now let's talk a little bit about our lunch and breaks. Now we typically bring a lunch box that serves as a bench as well for us to sit and have our lunch. So we need to make sure that we clean those surfaces before they get into our car and certainly before we get into the home again. And in terms of bringing our own food, that is the safest way to handle this. Just think about it. I know it's convenient to go to the coffee truck, but someone had to deliver the food to the coffee truck owner. The coffee truck owner had to load the food into the truck to bring to your site. You may not be the only site on his or her route. Therefore, the contamination of the food products inside are very possible. And then once you're there, you have to open the sliders and get the food, and you're going to be touching different food items to select the one that you want to get. So you can just imagine the possibilities there. So again, the best way to do this is bring food from home. And then we'll talk about driving and parking. If you're working anywhere near Toronto, parking is a problem. So a lot of workers carpool together and get to the site that way. Sometimes there's shuttle buses to take you from the parking area to the work site. These are potentially hazardous situations. We need to have policies and procedures in place to prevent this. And when it has to take place, there has to be measures and procedures within the shuttle buses to make sure that there's distance between workers, including more buses, taping off seats so that the driver is safe, as well as staggering the workers in the buses. Now, we've also talked about gloves and their importance of having gloves. Safeguards for gloves are important. There have to be procedures that have to be carried out, and the type of glove, how we clean the glove, which the gloves have to be cleaned daily at least, or multiple times a day is better because they are a surface and you are touching surfaces with them. So we need to have instruction on proper removal, hand washing and sanitizing before putting on and taking off gloves. The other thing I want to raise attention to is the rubber nitrile gloves. It's not recommended by public health authorities to use them outside of healthcare facilities. The reason for that is they are plastic and they will carry the virus. So only as a last resort should these rubber nitrile gloves be used on the construction site. The other one is masks. Now, we've heard about masks on the news, and the N95s are the best masks that you can have. They're required to be fitted, and they're high filtering masks. Surgical masks block droplets. They'll block some droplets from others, but they are non-high filtering or fitted. So just to simplify this, if you're wearing a mask that's not an N95, your mask is protecting your coworker, and your coworker mask is protecting you. With all this information out there, we need to have instruction as well. We need to learn how to use the equipment that we're given and be instructed on proper procedures, but that also includes training. There have to be a number of procedures for COVID-19 that are backed up by training. Training can include how to safe distance in certain scenarios, how to select and use the required PPE, how to disinfect the PPE. Also, making or using disinfectants. We need to know what the SDS sheets say, and we need to be trained on WHMIS to be able to understand the information provided for us. Toolbox Talks are another great way to get information to the workers, or for a worker to receive information. Obviously, we're going to talk about their daily requirements of what we're doing, where we're doing them. And in fact, the guideline requires employers to keep track of which crews work together and where they work. Should someone come down with corona, they would then know which crew was in proximity and where they work, so that area would have to be cleaned and the other workers isolated. So we'll be looking for signs of infection during this toolbox talk. We'll be dealing with things like, how do we address pedestrian traffic, traffic control? How do we maintain a safe distance during that? How about homeowners that are already on site who are wanting to talk to the construction crew? Property managers dealing with issues on site? Or working with outside workers like engineers, inspectors, security, or emergency services should an emergency happen. So let's talk a little bit about emergencies. We'll start with non-COVID-19 emergencies. And unfortunately, things do happen. It could be a fire, it could be some type of accident in the workplace. The responding workers must be wearing PPE. Therefore, the PPE must be readily available and ready to go. Other workers avoid gathering. I know we're like moths to a flame, but we need to stay away. If you have to observe, then do it from a safe distance. In an evacuation, we still have to maintain safe distance when leaving the site. We must leave the site in an orderly fashion, maintaining safe distance. And then once we get to the muster point, we have to maintain a safe distance there as well. For COVID-related emergencies, if a worker gets sick, they must leave the site immediately. For confirmed cases of COVID-19, upon learning of these, we got to close the site using emergency evacuation while maintaining safe distance. Ensure the other workers at the site are tested, and with a worker test possible, they must isolate. And that worker must not be financially penalized for protecting the others. And that takes us to the reporting. We need to establish clear illness reporting and tracking. Employers must report all known work-related positive results for COVID-19 to the Ministry of Labor in writing within 4 days. They must inform the Joint Health and Safety Committee and safety representatives and the trade union, if any. For more information about the workers' health and safety, be sure to visit our web landing page dedicated to worker rights. Our frequently asked questions section is also a good source of information about worker rights and employer responsibilities. Thank you for joining us today. I hope you found this information useful and that it serves to protect construction workers during this time. Please fill out the short survey and submit it. It would be most appreciated. I will take questions, but if you have more information, be sure to visit our COVID-19 resource page. There you will find a number of related documents, including our fact sheet, Construction Workers Confronting COVID-19. I will get to your questions shortly. So I have a question here about recommendations for carpooling. And like I said briefly, this is a much more complex than I can raise at this time, but there has to be a plan in place by the employer to ensure that there's enough parking, for example, and to get people to the job site safe. Now, at this time, I don't know exactly what the protocols are for that, but it's something that we'd have to look more into and possibly get back to you. I got one here about how can we avoid sharing tools and equipment with others. Again, it boils down to procedures. The employer has to put procedures in place, perhaps purchasing more equipment, segregating smaller crews doing different tasks where they're using different equipments. I mean, let's face it, you know, in construction site, you want to grab a shovel. The first thing you do is you're going to spit on your hands so that you have good grip. It's no different than someone in an office licking their fingertips to get grip of paper. It's just something that happens. And it's such an instinct that we do that it'll be difficult to forget to do that or not forget to do that. So definitely there has to be a plan, and the employer has to step up and make sure that workers have means to their own equipment. And when it's not possible, there are things that obviously they can't get all at once. We need to disinfect and sanitize. And if you go on the Workers' Health and Safety Center's YouTube channel, there's a video there on how to clean and disinfect non-medical surfaces or workplaces. So there you'll get some good information on how to disinfect it properly. And I think that answers the question about how do we clean and disinfect. There is a formula that you can make yourself. If you go on one of the Canada health pages, there's a list of products that are approved by the government for cleaning. Let me see here. It says here, this is an important one. Who should a work refusal be reported to on a site? Always, the work refusal starts with the worker speaking with the immediate supervisor and addressing the situation there. And if the thing doesn't get resolved, the supervisor will then have to make sure that a worker rep is involved in the work refusal. And then there's a process that's outlined in the Health and Safety Act. But it typically starts with a worker addressing a concern with the supervisor, and then it continues through the different steps. So again, speak with your supervisor. So I got another good question here about what are the best recommendations for gloves to wear at work? Again, there are so many different construction sites out there with so many different scenarios that I won't be able to answer that effectively. But certainly one would have to look to the manufacturers, and they would have specifications as well as suggestions for the best type of glove for the work that you do. And typically the best type of glove may mean something that you could toss after one use. If you're working with like welding or something where there's hot surfaces, that would require a different glove. So at this time, I think the best bet is to look at how and what type of glove you're going to use. Just looking down here at the answers, it's asking, someone was asking, how do you handle reprisals from employers expressing concern for speaking out? Section 50 of the Occupational Health and Safety Act does have a step-by-step there about what employers can't do for you acting on behalf of your rights, the Health and Safety Act. So the first thing is that you can start off by showing that to the employer and saying, listen, you can threaten me, intimidate, or coerce me, threaten to suspend me because I'm exercising my rights in the Health and Safety Act. And then certainly after that, if that doesn't work, you can always contact the Ministry of Labor and speak with someone there about that you're being reprised for acting. So again, I got some really good questions coming in here. I'm trying to get to all of them. So one question was, what about bus travel for those that don't have vehicles? Unfortunately, this webinar wasn't long enough. I could spend all day on it, each one of these topics, and give you some insight. So I'll start off with, depending on where you're living, I know in the Toronto area, the TTC has maintained a high level of buses. They've taped off corners. They're expecting people to sit at every other seat to maintain safe distancing wherever possible. And I know some construction sites, they will actually, people will meet at a yard and then they'll hop on a bus provided by the employer to take them off to a site. It could be an hour drive away into the bush to do some work. So there's so many different scenarios. The other thing is, again, it's the last resort, but wearing masks may be a solution for those when you can't maintain the social distancing. I personally would have a mask in a Ziploc bag in my pocket, ready to go should something happen like that. Just looking through here. Just looking through some more questions. Well, I think I've gotten to all the questions. I see one coming in. All right, so this is actually really good question. What if someone has mild cold symptoms but go to work and no fever? I mean, again, if you go to our YouTube channel, there's a webinar on the precautionary principle, and our position in this is better to be safe than sorry. And this is something that there are people who have the coronavirus that are showing no symptoms. Some are showing mild symptoms, and the symptoms can vary between people. I've even heard that some were having a rash. So the best thing is go get tested. Don't take any chances. You need to let your employer know. Again, if you go back to a couple of slides back where I said that we have to develop illness reporting to the employer. So there has to be a system in place, and get that information out to all the workers so they know what to do. But certainly, whether it's mild or severe symptoms, we need to get tested. Okay, thank you so much. And that's all for today. Be sure to look at our website and get more information, and you can send in questions to our Contacts Us page, and we'll be more than happy to answer them for you. Thanks again, and have a great day, and be safe.